Brilliant. So, I'm going to introduce myself. I am Rachna Murthy. I'm an Oculoplastic Surgeon. That means I do surgery around the eyelids. I'm an ophthalmologist in training, and I went on to go and learn how to do plastic surgery around the eyes and spent about 20 years learning to do that. And so this area is of key interest for me. So today you are unique because you are in the launch of this amazing product. And this amazing product is Botox in a bottle, so you can actually use it on the skin. It is a total game changer. And I use that word a lot for lots of things, but for me, personally, I haven't been able to deal with the lines under this area without surgery for my patients. I haven't been able to deal with the lines in this area without going down the route of doing something invasive for my patients. And probably most of you have found that as well. So there is a limit to what we can achieve with toxins. So we're going to be talking about Revox Line Relaxer. And I do want to take you through the science, basically because it helps us understand what it's doing. Okay, so this is a little video. Okay, really important area of our face. When we are talking to people, we express emotions by looking at people's faces. It has the thinnest skin in the body, so it has 7 muscles around each area, and every time the muscles contract, our skin moves. And when we lose collagen, you find that there are lines and wrinkles forming. Now in the skin, there are receptors. Those receptors will control how the muscles move, but they will also control sebum secretions and sweat secretions. When we use Botox, we inject into the muscle. And this is what happens in the nerve endings. And there is acetylcholine release. They bind to the nerve endings and they block the nerve transmission. For the first time ever, we've got something that's topical that can be put on the skin that has Botox peptides that can block the nerves in the skin and also in the muscle. So it diffuses from the epidermis and it diffuses towards the muscle, and it can block also the transmission in the nerve endings in the muscle. And what we are seeing with this clinical studies that we'll be talking about is that this combination of topical and toxin injectable can give our patients much softer lines and wrinkles in areas that we can't treat with injectables. What is Revox Line Relaxer? So it's a serum, and it can help to reduce lines and wrinkles without giving injectables. What's so new and exciting about it is that it works in combination with injectables, and it enhances the effect of the toxin that you're using. And this is a completely breakthrough formula. When it was launched in the US, the sales of it rocketed, and we're very fortunate that it's finally arrived across onto our shores and we're able to use it for our patients. So what is it? So the technology is patent pending, and it has 5 neuromodulating peptides. In addition to this, it also has something called GABA, and GABA, as you saw from the video, also works in the keratinocytes in the skin, and it helps to modulate the acetylcholine in the skin. On top of that, there are dermal support blend peptides. So that's the 3 extra peptides that make up this really novel formula of 8 peptides. There are also botanical extracts, hyaluronic acid, inulin, which is something that is also really, really new and exciting because it works on the microbiome. So not only are we able to modulate the acetylcholine and soften the lines, we're also able to soften the lines by acting in combination with protecting the microbiome and also with arnica, which also, as you know, so who gives arnica to their patients afterwards? Why do you give arnica to your patients? It can help to improve the recovery. And so this is a really key ingredient in this product as well, because this can be used straight after your injectable treatments. It can be used in the long term as well for recovery. And it can reduce bruising, it can improve hydration, and it can soften the lines. And the other exciting things about it, it doesn't have any of the toxic things that we very often see in products that are used around the periocular area or around the mouth. So it doesn't have any alcohol, it's fragrance-free, and it has a skin-neutral pH, which is something that you would want to be effective for protecting your microbiome. Okay, so we're going to have a look at the science now. And this is a summary of what we know so far. So a lot of the science has been carried out in the Petri dish, but I'm also going to show you some of the clinical studies that were carried out in America as well. So what we know so far is that this novel technology with these peptides and GABA can actually regulate the production of acetylcholine in the skin. All of the studies so far have been looking at acetylcholine in the muscles. For the first time, we're looking at the effect of these peptides in the skin. Not only can it regulate the production in the skin, it can also affect the diffusion of acetylcholine from the skin to the muscle. So with our injectables, we're trying to locate the toxin right in the muscle. We're trying to get it not to move too much. And it's going to be working just on the muscle. But for the first time, we're able to modulate the amount of acetylcholine in the skin and also the muscle by using a topical agent. Okay, and then the last bit of the science that we're going to look a little bit about is, you saw in the video that there were these receptors called M1 receptors. That's the muscarinic receptor. And the muscarinic receptor is present in the skin, and it is the receptor that is involved in sebum secretions and sweat production. So who treats hyperhidrosis here with toxin? And where are you injecting your toxin for your hyperhidrosis? Are you going into the muscle or are you going into the dermis? So can you imagine what we might be able to achieve with something that works on the skin, which is where the sweat glands are, with a topical? I mean, the future is bright with this product. Okay, I've come up with another study idea, sorry. Yeah, lots of other study ideas. I'm not going to give away too many of my secrets. What happens in the skin? So these are the first studies that have been run in the skin. All of the studies so far have been looking at Botox and other toxins in the nerves. So these studies were run on keratinocytes. And I'm going to go through this in a little bit of detail because it's quite a busy slide. So what we're looking at on the y-axis, it doesn't actually show up on the screen, but on the vertical axis is the level of acetylcholine. And on the x-axis, the horizontal axis, there are three different bar charts. And what this slide basically says is that if you look at the first lot of columns, this is in a patient's skin, or looking at the keratinocytes and the levels of acetylcholine when there is no treatment with this product. And there is an enzyme called neostigmine that blocks the enzyme that breaks down acetylcholine. So neostigmine increases levels of acetylcholine in the skin or in the muscle or wherever it's given. So the first lot of columns are in untreated skin. And what you see is that neostigmine increases the level in the orange bar of acetylcholine. But what happens when we use this peptide product, the Revox Line Relaxer? So these are for two different concentrations. We'll look at the 0.01, which is the highest strength first of all. And you'll see that even in the presence of neostigmine, the levels of acetylcholine in the skin are reduced. Now, they also looked at a lower concentration. Does anyone know why we might want to be looking at a lower concentration of the product? We want to know whether it's toxic. We want to know whether it kills off the cells. And so what we're finding is that actually you can go down with the concentration and you can still have the same effect in terms of reducing the amount of acetylcholine in the skin. So this is a product that's very effective, it is not toxic, and it works on the skin. So this particular slide was looking at time. How long does it take for it to reduce the levels of acetylcholine? And what we see is that at 72 hours, there is a reduction. That's a grey hatched column, there is a reduction in the amount of acetylcholine in the skin, but this continues to work. So at 96 hours, there's even less acetylcholine. So it's a product that is continuing to work. Now this is the bit that we need to do a little bit more research in. How does it work? We don't really fully know how it works. We know it interacts with acetylcholine in the skin, but is it down-regulating the receptors, or is it just reducing the amount of the acetylcholine hormone that's in the skin? So if we look at the bars, they're all about the same. What we do know is that if you have neostigmine, that actually will increase the levels of acetylcholine. Increasing the levels of acetylcholine will increase the levels of receptors, but we're seeing in the second bar it's actually going down. We're seeing also with the product that the bars are going down. So we don't really know at this point whether it interacts with the receptors, and that's something for future research. Okay, so in vitro studies. Any questions from the in vitro studies? Completely stunned you into silence with the science. So we know it works. We know it can reduce the levels of acetylcholine, and that's how it is working in terms of improving the relaxation of the lines, but also the skin quality. So you'll know some of these faces: Dr. Shinobe Aguilera, Justin Harper, Kim Schultz, and Glynis Ablon, and they ran the clinical studies in the States. There were two separate studies that they did. So what we want to know is, can LineRelaxer alone improve lines and wrinkles? Do we have to use toxin? So that's the standalone clinical study. And then we also want to know is, if we use toxin and we use LineRelaxer on top of the toxin, can that give our patients an even better result? Can it work on areas where we haven't injected the toxin? So that's a procedure pairing clinical study. Okay, so we'll go to the standalone study first. So this is looking at whether or not just using the serum can improve the lines and wrinkles. Okay. It's a 12-week single center study, blinded and randomized with a placebo control. There are set recruitment criteria, and people were excluded for the usual reasons, which I'll show you. And they followed a protocol of a morning and evening routine with this product. They had 56 females in the study. 33 of them were on the treatment arm, 23 were placebo. They were aged between 35 and 60, various different Fitzpatrick skin types, and they had their lines and wrinkles assessed in terms of severity according to various different scales. So there's a global face wrinkles, global fine lines, and relating to photo damage. They all had to stop their topical treatment. So it's no point running a study if somebody's on their retinol or they're on their vitamin C or something else, because you want to see whether the effect is from the actual new product. And people who were pregnant, nursing, planning a pregnancy were excluded from the study. Okay, so this is what they had to do. They had to cleanse their face in the morning with a gentle cleansing lotion. Then they had a full face application of the Revox, so not just in the lines, but in the whole face. And then they followed it with their SPF, which was standardized. And in the evening, they did the same thing as well. So they cleansed their face with the lotion, followed by another full face application of the Revox, or placebo, if they were in the placebo arm. And then they followed with a moisturizer. So they're trying to keep to the same regime that people normally would have, but get rid of the active ingredients from their skincare, apart from the LineRelaxer or the placebo. So this slide basically says that virtually all of the subjects qualified for being in the study group, and 98% of them completed the study. In the treatment group, 100% of them did, and some of the placebos dropped out. Demographics, various, so mean age was 48, various different ethnicities and skin types. So at 15 minutes, and this is something that's unique, who finds that their patients have noticed an improvement after they've given their injectables within 15 minutes? With this topical treatment, patients were noticing an improvement at 15 minutes post-application. Okay, there are other things in the product. There is hyaluronic acid and there are other things, but they were noticing that their lines were softer. And that is pretty good stuff if it's going to do that for you within 15 minutes. And after 8 weeks, nearly a third of them thought that their lines, the expression lines and under eye lines, which we don't treat with injectables, improved. And after 12 weeks, about 40% found that those lines were better. So it continued to improve. And this was highly statistically significant, not just in terms of lines and wrinkles, but also the brightness and radiance, the texture, and the overall appearance. So this shows really the efficacy at 15 minutes, improvement in terms of fine lines and also deeper wrinkles. The green bars compared to the blue bars being placebo and the green bars being treatment. And so overall, there was improvement in fine lines, overall appearance, texture, both to touch and also visually, brightness, wrinkles and firmness. So it's pretty exciting stuff. Everybody found it was great. And I'm going to show you some pictures. So this was just, remember, no toxin used in this. This was just using the topical. And this is a standard light. Before and after 12 weeks, just looking at the glabellar area. Looking at the crow's feet. And also, if you have a look at the under eye area, that also improved. So you wouldn't be treating that with toxin. Again, under eye and crow's feet. So these are really exciting results for the periocular area. How about lines anywhere else? I mean, that's not the only area that we treat. How about lip lines? Is this an area that we can treat for lip lines without running the risk of causing problems with expression and speech and swallowing? So the topicals also, as a standalone product, improve lip lines. It improves actually also the deeper nasolabial folds. There's no filler treatment. There's no injectable treatment. Same again with this. So it was really exciting to see this, but we've got just pictures, and objective outcomes are quite difficult to have with these types of studies. So they also used a 3D camera. And with a 3D camera, that was able to pick up the reduction in the lines in the crow's feet area, and also be able to demonstrate that objectively with a scale. So this is really exciting because it's objective outcomes that we can share with our patients. Okay, so to summarize that one, it was safe. Everybody found that they could tolerate it, and the results were really well received by the patients. And the really exciting thing is that it can be used to treat all the facial expression lines. So not just the periocular area, the entire face, potentially the neck, the décolletage, all of those other areas that you may not want to inject or they may not want to have it injected. Okay, so how about with the use of injectables at the same time? So the hypothesis here was that if you use an injectable treatment for your patient, and then you put on this serum straight after the treatment, or soon after the treatment, is that going to give you a reduction in the lines, even though you haven't got any effect on the muscle? And is that also going to be something that works in synergy with your toxin injectable? Does it give you a better result at the end once they've been using the combination. So again, similar scales. This is a multi-center study again, running for 12 weeks and 3 sites. And similar inclusion and exclusion criteria. And this was a split face study. So in order to be able to compare whether or not there is an additive effect from the serum, one side was treated with injectables alone and one side was treated with injectables and the serum. Demographics are very similar, around 50 in terms of age, and various combinations of ethnicity as well as skin type. So the pictures on the left are baseline pre-injection, and the pictures on the right are at 4 weeks post-injection. But the injection is given in standard points in the crow's feet. It's not given under the eyes. If you have a look at the post-injection, in the placebo, first of all, which is the bottom one, the under eye area doesn't look that different in the after. If you look at the treatment one, these patients were using their serum in areas away from where the injectables were given, and you'll see that the under eye area is also softer, giving them a better outcome from their treatment. Same again with this one, with maximum smile. So bottom is just injectables, and the top is injectables plus Revox Line Relaxer. Again, the whole of the under eye area has improved, as well as an improvement in the crow's feet. And this is a younger patient, and even the very fine lines have improved in the top picture. These were highly statistically significant. There was 100% improvement in the fine lines at rest, and 100% greater improvement in the crow's feet and wrinkles at rest. So not just the fine lines, but the deeper crow's feet and wrinkles. And 93% of these subjects showed an improvement, which is pretty good for a clinical study. 90% of them showed improvement in the skin texture in the periorbital area at maximum smile. And all of them found that they had no signs of erythema or edema. One of the things that you sometimes hear about, and I'll get a hand sort of straw poll again, how many people have had issues where their patients have said, oh, I've got puffiness around my eyes after my toxin. So that's a worry that you might have. You know, is this going to cause more puffiness because it reduces the pump mechanism around the eyes, which you can get with your injectables? No, it doesn't. 94% of the subjects said it wasn't irritating. So again, you're putting something very close to the eye. Is it going to irritate your eyes? We can all get irritation in our eyes. We just walk into a dusty environment, we get irritation. 94% of these people putting the serum near to their eyes found that it was comfortable. So why would we consider? I think I pretty much told you why I would consider it, and I think this is a total game changer for me, and I'm pretty sure it'll be a total game changer for you. Neuromodulators can only take us this far. To get optimal results for our patients, we need to push the boundaries further. We need to be able to offer all the tools available to us, which now are. And it can do so much more than just rejuvenate the skin. And I think this pair, as you can see from the study, the combination of using toxins and Revox Line Relaxers will give us the best outcomes for our patients. There are some references if anybody wants to take them down. And hopefully I've shown that you can see the power of synergy from the studies, and you can now see it for yourself. These are the prices if anybody wants to know. And you've all got a bottle in your bags, but do go and visit the stand, and I'm going to take some questions now if you want. I'm more than willing to answer. We've got plenty of time, so feel free to fire away and I'll try and answer some.
How
Okay, so when we stop using Botox, that's a really good question. When we stop using Botox, we know that Botox at the levels that we give with a standard dosage regime will take about 3 to 4 months to disappear from our system. And then people start noticing that their mobile kinetic lines start to reappear. But here we're acting on the skin. So we're improving the skin quality, not just the muscle movement. So you'll find that the muscle movement probably comes back around the same time as it would do when the Botox wears off. I don't have the data to share with you, but we can direct you to the right people to look at the longevity data. But even when you stop using your serum, because you've improved this sebaceous secretions, the sweat gland secretions, you've reduced the motility as well, then that effect is long lasting, and you saw that it was additive if you kept using it.
Eye creams sit with this, you know, if people want to improve, you know, the quality of the skin with any stimulation.
So what are the things you would normally recommend for your patients for the eye area? It's a really good question, Rosie, because we are pretty limited in what we can do safely for the periocular area. Vitamin C's you might be using to improve brightness. You might be using a retinol, which might improve the collagen in that area. With this product, you're getting a much better result because it has not only a hydrating property, it has antioxidants. It also, has arnica to help reduce bruising and improve brightness. And it also works on the muscle as well as the skin. So I think this is going to be making a lot of other products, well, I can't say that because AestheticSource also does lots of great eye products. So we'll have to see, but I think this will probably be the one that stands head and shoulders above everything else.
And the photo at 12 weeks, that's been marketed for?
It's marketed for all the face, all the lines, but the focus is on this area because, first of all, that's the area that was first studied when we came to Botox. Botox was used in ophthalmology, and the initial FDA approval for the use of Botox was around periocular lines. So there are lots of studies that can be compared with this relating to treatment of the periocular area. But yes, it can be used for every area.
And where exactly are they applying? Just under and around, or are we going onto the top layer?
Top layer. I recommend to my patients they use it all over, not in the eye. So stop at the lashes. It has microbiome protection as well, and use it in addition to all the other products that CHD Limited produces here. We've got Ross here and we've got Charlotte here. So,
Rachna, how long would that last a patient for if they use it just for the eye area morning and night?
how long would they continue to use? How long does it last for?
How long does it last for?
So these are the bottles. These are the bottles that. So there are two different bottles. Have we got any of the bigger ones here as well? So there are ones that you can have in your clinic. So you can put it on after their treatment. So you've got the whole area clean and sterile. You can put it on after their treatment. So if they're not going to purchase it, you might use it as part of their treatment and encourage them to use it. So there is a bigger one. But these are the ones that they would go home with, or they could buy the big one. And so this would last about 3 months. They recommend about half a pump. So it's got a little styler at the end of it. I don't know whether you saw from the picture, which is really nice because you can squish it, a little bit comes out, and then they can apply it. You can direct them. It's good for lymphatic massage as well. You know, after your treatments, they can use the serum as well as improve the lymphatic massage around the periorbital area. Apply it to the brow. Apply it with the finger or with this.
Who's this bought through? Is it through the pharmacist?
AestheticSource. AestheticSource are the only distributor for this product in the UK. Thank you.